thank you for coming to another episode of Health Topics with Nurse Beckie. And anyway, I'm coming to you live from Derry Presbyterian Church on this very cold day. So today we're going to be talking about 20 common health screenings. And I'm going to do a disclaimer here is that this presentation is for educational purposes only and is to only briefly describe health screenings and not delve deep into each one. Further questions or conversations about these different health screenings you can address to me by contacting me at a later date. So let's get started. What's going on here? Okay, so we have our scripture. It's a cheerful heart is good medicine, but I can't see the word, spirit drives up the bones. This verse highlights the importance of a positive job and for overall well-being. So that's our scripture for the day. Now we're going to start with blood pressure measurement. The purpose of blood pressure measurement is to check for hypertension, high blood pressure, and the frequency should be done once every 2 or more years or more often if at risk. Blood pressure is the pressure of blood against the walls of the arteries. Arteries carry blood from your heart to other parts of your body. The systolic pressure, which is the top number, is the pressure on the arteries when the heart is in full beat. The diastolic, or the down number, is the pressure on the arteries when the heart is at rest. So that gives you a blood pressure. Normal blood pressure is 120/80. And let's see, here we have the chart of what's normal. And these are the different categories of blood pressure that is used by the American Heart Association in all healthcare. High blood pressure is called hypertension. And the higher the blood pressure is, the more risk one is at for heart disease, stroke, and heart attacks. Symptoms. Usually there is no warning symptoms, and that's why high blood pressure is also called the silent killer. And measuring blood pressure is really the only way to detect high blood pressure. And high blood pressure can cause, the causes of high blood pressure are the different lifestyles, certain health conditions, diabetes, obesity, and age. High blood pressure can hurt important organs like the brain, stroke, the heart, cardiovascular disease, can hurt the kidneys and the eyes. So that's why we want to be taking our blood pressure. Preventative actions include not smoking. Not smoking is a big one. Exercising, eating a healthy diet, limiting the amount of sodium in your diet, and maintaining a healthy weight and managing stress. Okay. The next screening that we have is the body mass index. The purpose is to assess if an individual is underweight, normal weight, overweight, and the frequencies, it's usually done during your regular checkup. But anyway, the body mass index, or BMI, is the measure of the person's weight divided by the square of their height. And BMI screens for weight categories that may lead to health problems, but it also does not diagnose any kind of fatness or health of an individual. And right now, with other techniques of determining body health, the BMI is falling out of favor in lieu of other health assessments. So we don't go by body mass index, like they used to. And body mass index was developed in the early 20s, I believe it was, by insurance company and only took into account white males. So that's how come it's kind of outdated now, because we have people of all sorts of ethnicities and weights and heights. So we don't use that much anymore. But it is just part of health screenings. The next one we have is the eye exam. And The purpose is to check for vision problems and eye diseases. We want to do that every 2 years for those with normal vision and more often for those who may need help. And then during this exam, your provider checks your vision and eye health. Health problems can also be detected that are not eye related, such as autoimmune diseases, diabetes, and diabetes related retinopathy, which means problems with the retina, high blood pressure, high cholesterol, and arterial disease. And you will also be examined for visual acuity, meaning nearsighted or farsightedness, astigmatism, and anything else that can affect the vision of your eye, such as cataracts, age-related macular degeneration, and glaucoma. The next one is your hearing test or audiometry. And this is to assess hearing function and detect hearing loss. Excuse me. And this is frequency is as recommended, especially for those with age-related hearing loss or exposure to loud noises. And what the audiologist does is it evaluates your hearing for the type of hearing loss you may have, and if your hearing loss is mild, moderate, or severe. When you enter into your 50s and 60s is when many people start having age-related hearing loss. 1 in 3 people have hearing loss between the ages of 65 and 74, me included. And after the age of 75, 50% of people have hearing loss. Causes of hearing loss can include exposure to loud noises over a period of time, infections, family history, diabetes, high blood pressure, and age. And age-related hearing loss is a progressive condition that gets worse over time. It doesn't get any better, but we do have devices that can help manage hearing loss. And one of the big takeaways for this is not being able to hear is associated with cognitive decline, decreased socialization, loneliness, and decreased overall health. So it's real important to keep people hearing. And Diana, we have hearing loss in our family. So you need to be aware of that.
I'm well aware of that one.
Oh, yeah, I bet you are.
What?
I bet you are.
Just kidding.
Uh-huh. Okay. Next one we have is dental checkups. And we do dental checkups to assess oral health and to detect dental issues. And we recommend every 6 months for routine cleaning and checkups. So routine dental cleaning offers a good number of benefits, including reduced risk of serious oral health issues like cavities and gum disease. Routine teeth cleaning can help reduce your risk for heart disease, stroke, and dementia. It prevents bad breath by removing harmful microbes that can cause disease. And preventative dental care can help stop issues before they start, and this can save time, money, worry, etc. in the long run. So for optimum health, you need a combination of good at-home oral hygiene and professional dental cleaning. Okay. Next one is skin cancer screenings. And the purpose is to detect skin cancer, regular self-exams and professional exams as needed. Okay, so the skin is the largest organ in the body. And skin cancer is the most common kind of cancer that we have. It is a disease caused by abnormal cells growing in the tissue of your skin. These cells can cause tumors to form, and if found early, most skin cancers are easily treated. Risk factors include extreme sun exposure, family history, many moles and other skin conditions, and of course, age. So we want to be looking at our skin all the time to make sure anything out of the ordinary is checked out. Allergy testing. Purpose is to identify specific allergens that may be triggering allergic reactions. And it's as recommended for those who are having allergy symptoms. An allergy is the body's response to a specific substance, and your immune system overreacts and produces antibodies, also called proteins, called immunoglobulin E, IgE. These antibodies trigger the release of chemicals that cause the allergic reaction. Testing identifies allergens like mold, pet dander, bee stings, and peanuts, to name a few. There's a whole lot more other ones that they test for. And it's done by a skin prick, and allergens are introduced into the skin to check for reactions such as a wheal, which is a raised mark, rash, or other reactions. And allergy testing is done on those with asthma so that any triggers that may cause a reaction can be avoided. People may be allergic to food, such as milk, soy, nuts, pet dander, bee stings, medications, metals, nickel, mold, or pollen, to name a few. Treatment and management of allergies. Let's see, you want to minimize exposure to allergens, take daily allergy medications, possible allergy shots. They do that a lot for animals. And you want to be carrying a med card to alert anyone about a severe allergy you may have. And then carry your epinephrine pen or your EpiPen with you wherever you go so that you can be treated in case you have a severe allergy attack. The next one is the dual energy X-ray absorptivity DEXA scan. Okay, let's just call it a DEXA scan. And this is to assess bone density and to detect osteoporosis. And it's as recommended, and it's typically started postmenopausal women and later in life for men. And so what the DEXA scan is a measuring test that measures bone density and help determine your risk for osteoporosis. Are you okay, Tom?
No, my wife's trying to butt in here.
Oh, well.
Okay, sorry to interrupt. Proceed.
Oh, that's okay. So, but determine your risk. Hello.
Hi there. I had it done.
Okay, good.
Go away.
Yeah.
Okay.
Okay, so it determines your risk for osteoporosis, bone loss, and fractures, which are breaks. The test can also measure body composition, such as body fat and muscle mass. It uses low levels of X-rays to measure how dense your bones are. Osteoporosis is brittle bones or porous bones. And as we age, our bones can lose thickness and strength, which can result in broken bones. That's why people who fall so often get a broken hip, broken arm, broken leg, you name it. It is most common in postmenopausal women. The DEXA scan measures the mineral content in certain bones, such as the hip, the spine, and the wrist. Okay. The next one we're going to is the mammogram. And the purpose of the mammogram is to screen for breast cancer in women. And frequency is every 1 to 2 years for women aged 40 and older. So what the mammogram is a low-dose X-ray used for breast cancer screening and as a diagnostic tool. It can show abnormal, usually non-cancerous or benign areas or tissue in the breast and can help detect cancer before symptoms appear. Breast cancer is the most common cancer that affects women. Early diagnosis through screenings has a greater overall impact on survival rates. So the sooner we get it done, the better. And this is really important, most findings in mammograms are benign or non-cancerous. Fewer than 1 in 10 people who need additional tests after a mammogram have cancer. Mammography is 85 to 90% accurate in detecting breast abnormalities before they are large enough to be felt. But so a few things that you need to let the technician know before having your mammogram is if you have recently had a vaccine and in which arm. And especially the COVID-19 vaccine may result in swelling of the lymph nodes in the armpits and can cause temporary lymph node enlargement visible on a mammogram. So you want to let them know beforehand so that they don't get all worried about it. Next is the Pap smear test. And this is to screen for cervical cancer in women. And this is every 3 years for women ages, let's see, I can't read my thing here. And every 5 years for women, 50 to 65 with HPV testing. HPV is human papillovirus. Okay, Pap smear screens for cervical cancer, checks for abnormal cells in the cervix that are cancerous or have the potential to become cancerous. The smear may also detect certain infections and inflammations. Pap smears are a life-saving screening tool. The test identifies abnormal cervical cells before they have a chance to become cancerous. More than 95% of the time, people treated for precancerous cells do not develop cervical cancer. So this is a really important test for women. The next is for you guys, Tom,
Oh,
the digital rectal exam. Yay! This guy here looks pretty scared. He knows
no,
what's coming. Okay, and this is the purpose of this is to screen for prostate abnormalities or conditions such as prostate cancer, and it's as recommended, and sometimes with PSA testing, but we'll talk about that in a bit. And a digital rectal exam checks for abnormalities in the rectum, the anus, and the prostate gland in men. It is a diagnostic tool to many different medical issues, which may include inflammatory bowel disease, hemorrhoids, prostate infections, prostate cancer, rectal or colon cancer, trauma, and some neurological disorders. The exam usually begins at age 50. And here we have about the PSA test, which right now I can't think of what it is. Anyway, it's a test for, it's an older test that they used to use for prostate cancer, but its usefulness is in big question right now. So this is where you need, if it's recommended, then you need to have a big discussion with your doctor, and that is a must before you get this test done. Okay. Next one is the EKG, or the electrocardiogram. And the purpose is to record the electrical activity of the heart and to identify irregularities. The frequency is as recommended, especially for those with heart-related symptoms or risks. So the EKG is a way to get information to diagnose a problem with the heart. It can tell your provider if you've had a heart attack, heart failure, or heart damage, and it can also identify an abnormal or irregular heartbeat and can tell if the pacemaker is working, if you should have one. So electrodes are attached to the chest and the limb to track and document the electrical activity of the heart, and a computer translates the information to a wave pattern for interpretation. There's a little picture of a EKG strip. PQRS, the different waves. Next one follows that is the cardiac stress test. And this is the purpose is to evaluate how hard the heart responds to physical stress and identify potential heart problems. And this is as recommended, especially for those with symptoms like chest pain or shortness of breath. And this is an exercise test that determines how well the heart works during times when it is working the hardest. It usually involves walking on a treadmill or pedaling on a stationary bike while hooked up to an EKG monitor to monitor the heart's activity. And there may be many reasons for a stress test that may be used to detect heart problems, like congenital heart disease, congestive heart failure, coronary artery disease, heart valve disease, or cardiomyopathy. So the next test is our favorite, the colonoscopy. And this is the purpose is to screen for colorectal cancer and to detect polyps. And this is usually started at the age of 50 and then as recommended by your healthcare provider, how often it should be done, usually in increments of 5 or 10 years. It is used to look for changes in the colon, such as swollen, irritated tissues, polyps, which are a precursor to cancer in the large intestine and rectum. And so a long flexible tube is inserted into the rectum, and a tiny camera at the tip of the tube allows the doctor to view the inside of the colon. Polyps or other tissues can be removed, and tissue samples can be sent for examination. A colonoscopy can help explore possible causes of abdominal pain, bleeding, chronic diarrhea, or other intestinal problems. And colonoscopy is, I believe, always done under a mild anesthesia. So you go to sleep and get the best sleep of your life. Then they wake you up. So, but anyway, so you can't feel anything. It's a very important test. One of the next tests we are covering is the cholesterol test.
Answer it, Nancy.
And the purpose of this test is to assess levels of total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. Frequency is every 4 to 6 years or as recommended by your physician. And this is a blood test that can measure the amount of cholesterol or fat and triglycerides, which is fatty sugars too, in the blood. The test can help determine your risk of buildup of fatty deposits or plaques in the arteries that can lead to narrowed or blocked arteries throughout your body. High levels are often a significant risk factor for coronary artery disease.
25 minutes.
Okay. LDL cholesterol, which is the lousy or bad cholesterol, is low density lipoprotein that causes the buildup of plaque in the arteries and reduces blood flow and can lead to a heart attack. Less than 100 is desirable. The HDL cholesterol, or the good or the healthy cholesterol, is the high density lipoproteins, and that helps carry the LDL or the bad cholesterol away and keeps the arteries open and flowing. A value of 60 or greater is desirable. Triglycerides are the amount of fat in the blood. High triglycerides are associated with being overweight, eating too many sweets, drinking alcohol, smoking, inactivity, diabetes with high blood sugar levels. And the high levels put you at risk for cardiovascular disease. So those are what we want to be looking at here too. Blood glucose test. This is to screen for diabetes or prediabetes. And they do this every 3 years or as recommended by your provider. The glucose test measures the level of glucose or sugar in the blood. This test screens for diabetes, and this can be done by either a finger stick or a venous draw. You may be asked to fast for several hours before the test. A high glucose level may indicate diabetes, and a normal fasting blood sugar is 100 or less. And if it's higher than that, there needs to be further testing for diabetes. And diabetics will test their blood sugar several times a day to try and keep it in check into a normal level. Then we have the hemoglobin A1C test. And the purpose is to assess long-term blood sugar control and monitor diabetes. And frequency is as recommended for those with diabetes or at risk for developing diabetes. But this is a blood test used to monitor type 1 and type 2 diabetes and how well you're managing blood sugar levels over time, usually the past 2 to 3 months. The higher the A1C level is, the poorer your blood sugar control is, and the higher your risk of diabetic complications. So the numbers here are below 7.5% is normal. Between 7.5 to 6.4% is diagnosed as pre-diabetic, and 6.5% or higher on 2 separate tests indicate diabetes. For those with diabetes and A1C less than 7 is a common target. So if you're diabetic, we want to keep it below 7. The hemoglobin test, and this is the purpose to measure the level of hemoglobin in the blood, which can indicate anemia or other blood disorders. And frequency is as recommended, especially for individuals with fatigue or known risk factors. Hemoglobin is a protein that is the main component of red blood cells. It contains iron, which allows the protein to bind to oxygen. Hemoglobin enables red blood cells to carry oxygen from your lungs to other tissues and organs in your body. Knowing your hemoglobin level can tell you how healthy your red blood cells are. A healthcare provider can diagnose all sorts of blood disorders and other conditions such as anemia by your hemoglobin test. The next one is the thyroid function test. And the purpose here is to assess thyroid hormone levels and detect thyroid disorders. Frequency is as recommended by a healthcare provider, especially if there are symptoms or at-risk factors. And this test is to determine how well the thyroid gland is working. Thyroid hormones help the body use energy, stay warm, keep the brain going, heart and muscles, and other organs working as they should. The test measures the TSH, which is thyroid stimulating hormone level in a blood sample, and can help diagnose conditions such as hyperthyroidism, Graves' disease, Hashimoto's, and thyroid cancer. The test measures the thyroid stimulating hormone, which stimulates the T3 and T4 hormone. So you'll see a thyroid test with TSH with T3 and T4 levels. So that's normal. Now, thyroid antibody test tells if there are thyroid antibodies present, which may mean you have an autoimmune disorder like Graves' disease or Hashimoto's. An overactive or underactive thyroid can interfere with daily routines and hinder the quality of life. And then we have our last one. I saved the best for last here is the sexually transmitted infection screenings. And this is to screen for common sexual transmitted infections such as chlamydia, gonorrhea, and syphilis. Frequency is as recommended, especially for sexually active individuals and those with multiple sex partners. And this is a screening using blood, urine, or fluid samples to diagnose different types of infections. The screenings are for someone who doesn't have symptoms. Screenings are done for a variety of reasons, such as people at risk, pregnant women, women aged 21 and older, women under 25 who are sexually active, reinfection, and untreated partners, men who have sex with men, people with HIV, and people with new partners. Screenings are for HIV, hepatitis B, hepatitis C, chlamydia, syphilis, HPV, human papillomavirus, and gonorrhea. So anyway, that's the end. I'm opening it up for questions now, if anybody should have a question.
Well, I'll ask you one.
Okay,
The blood pressure levels are my current primary care provider says that elderly people should consider having a little bit higher blood pressure than the 120.
yeah.
Is
Well,
that correct, or is there a reason for that?
well, it is. They don't necessarily recommend that you have a higher one, but it is an accepted thing. And it can go up to like 140, the top number 140. And the reason is because as we get older, our arteries are not as elastic as they were when we're younger. And so that would account for that. So a little bit higher blood pressure is perfectly acceptable according to your age.
Okay.
But you don't want it up real high. But usually about 150 is the cutoff,
Okay.
which is acceptable.
Yeah. All right.
Good question, though.
Want me to think of another one?
Yeah.
Well, let's see. I'm just curious. Well, there is a cutoff age apparently for colonoscopies,
Yes.
which is, I'm told I'm beyond that age.
Yep.
So is there a reason for that?
The reason is that after a certain age, I think it's like 70, 75, all depends on your personal risk factors, is that the chance of developing colon cancer at that point is still there, but the treatment may be worse than the disease itself. So, again, that is determined by your healthcare provider and your own personal risk, but usually the cutoff is around 70, 75.
Yeah.
And plus, colon cancer is slow growing. And so chances are that it's not going to affect your life very much.
I've seen the same reasoning seems to apply to prostrate.
Yeah, exactly.
Okay. So I'm too old for anything to save me.
Oh boy. Well, it hasn't killed you yet.
All right, thank you.
Okay, any other questions?
Well, is there another lady on this by the last name as you?
Yes, I think she's still there.
Yeah, I'm
Who-
still here. I just don't have any questions, but great job, Mom.
Oh, well, thank you.
Yeah, wonderful.
I'll let you do, so, and I thank you.
Okay. Okay, well then I guess this ends the presentation, and here we go. Thank you for coming, and as usual, stay safe out there.
Same to you.
Okay, we'll talk later.